CNA Test Prep 2026. Welcome to the quiz. Question 1. You are working the morning shift on a busy orthopedic unit and are responsible for the care of 6 patients. During your rounds, you discover that one of your patients, Mr. James Rodriguez, a 65-year-old male who had hip replacement surgery 2 weeks ago, is reporting severe sharp chest pain that radiates to his left arm and shoulder. He appears pale and diaphoretic, and he tells you that he feels dizzy and nauseated. His wife is at the bedside and is extremely concerned about his symptoms, asking you repeatedly what is happening and whether he is having a heart attack. Mr. Rodriguez is visibly anxious and his breathing appears rapid and shallow. When you assess his situation, you realize this could represent a serious cardiac event or another life-threatening emergency. Based on this clinical scenario and the patient's presenting symptoms, what is the most appropriate and immediate action you should take as a certified nursing assistant? Option A. Assist the patient to lie flat in bed to improve his circulation, place him on bed rest, and then go to find a nurse when you have finished making him comfortable, explaining to him and his wife that chest pain is not uncommon after surgery and usually resolves on its own. Option B. Stop all activities immediately, stay calm, keep the patient calm by reassuring him, call for the nurse immediately using your call system or by notifying another staff member, and monitor his condition while awaiting nursing staff who can perform a comprehensive assessment and provide emergency interventions. Option C. Ask the patient to sit up in a chair to help with his breathing difficulties, suggest deep breathing exercises, and tell him to try to relax while you go retrieve some antacid medication from the supply room that might help with his chest discomfort. Option D. Document the patient's symptoms in detail in the chart. Wait 30 minutes to observe whether the symptoms improve on their own, and then notify the nurse if the symptoms persist or worsen, so that assessment and treatment can be delayed until you are more certain about the severity. The answer is B. Immediate action must be to get the nurse because the patient is exhibiting classic signs of a heart attack, chest pain radiating to left arm, pallor, diaphoresis, nausea, dizziness. This is a life-threatening emergency. Option A is incorrect because lying flat may not improve circulation in a cardiac event and could worsen breathing. Also, leaving the patient to find a nurse without calling for help first wastes precious time. Option C is wrong because sitting the patient in a chair and giving antacid is inappropriate. Chest pain of cardiac origin is not relieved by antacids, and leaving the patient to get medication is unsafe. Option D is extremely dangerous. Waiting 30 minutes or documenting before notifying the nurse delays critical intervention and could result in cardiac arrest. The only safe action is to stay with the patient, call for the nurse immediately, and provide reassurance while monitoring. Question 2. You are caring for Mrs. Patricia Chin, an 82-year-old female patient who is obese with a body mass index of 38, has limited mobility due to severe osteoarthritis, and requires maximum assistance with all transfers and repositioning. She is currently on bed rest following a fractured pelvis. This morning, she needs to be transferred from her bed to a wheelchair so that she can sit up for breakfast in the room's comfortable chair. Mrs. Chin is anxious about the transfer process because she is worried about falling and potentially injuring herself further. You know that improper transfer techniques could result in injury to both yourself and the patient. When considering the safest and most appropriate method to transfer this patient from bed to wheelchair while ensuring the safety of both the patient and yourself, what intervention represents the best clinical practice? Option A. Recruit 2 additional staff members to manually lift the patient by having them place their arms under her axillae and lower extremities. Then lift together using their leg muscles while the patient remains passive and allows them to do all the work of the transfer. Option B. Request and utilize a mechanical lift device, such as a Hoyer lift or other approved patient transfer equipment, with the assistance of at least one other staff member to ensure proper positioning, secure attachment of slings, and safe lowering into the wheelchair while maintaining the patient's dignity and safety. Option C. Encourage the patient to stand and pivot independently toward the wheelchair, assisting her only minimally by holding her arm and providing verbal cues. even though she has indicated her fear and anxiety about the process and has significant limitations with mobility. Option D. Have the patient slide herself across the bed toward the edge using her arms, and then attempt to stand with minimal assistance before pivoting to the wheelchair, explaining to her that this will help maintain her independence and strength. The answer is B. The safest method for a patient who requires maximum assistance, is obese, has limited mobility, and is anxious about falling is to use a mechanical lift. This protects both the patient and staff from injury. Option A is incorrect because manual lifting, even with multiple staff, places staff at high risk for back injury and the patient at risk for falls or skin shearing. It is not recommended when mechanical lifts are available. Option C is wrong because this patient is not capable of independent pivot transfer. Encouraging her to do so despite her fear and physical limitations could cause a fall and further injury. Option D is also unsafe. Sliding across the bed can cause skin breakdown, and attempting to stand with minimal assistance is not appropriate for a patient on bed rest for a fractured pelvis. Using a Hoyer lift is the evidence-based, safe choice. Question 3. During your afternoon shift, you are providing hygienic care to Mr. David Thompson, a 55-year-old male patient who has been hospitalized for 5 days with complications from diabetes. While performing a comprehensive bed bath and assisting him with hygiene, you systematically examine his entire body and observe several concerning findings. You notice that on his lower back, there is an area of approximately 2 inches in diameter where the skin appears bright red and does not blanch when you apply gentle pressure with your finger. Additionally, his right heel shows signs of early skin breakdown with a small open area surrounded by redness. His skin in the perineal area is also macerated and appears irritated from moisture and incontinence. You know that these findings could indicate the beginning stages of pressure ulcer development or other skin compromise. Given these observations and your responsibility for skin assessment and care, which action most appropriately addresses this clinical situation? Option A. Apply moisturizing lotion generously to all affected areas to help hydrate the skin. Cover the areas with thick bandages to protect them from further friction. And plan to reassess the areas in several days to see if they improve naturally on their own. Option B. Report your findings to the nurse immediately so that a comprehensive skin assessment can be performed, pressure-relieving interventions can be implemented, and a prevention plan can be developed to prevent further deterioration and wound development. Option C. Wait until the end of your shift to document what you have observed so that you can describe all the details accurately without rushing, and mention it casually to the nursing staff if you happen to see them before leaving. Option D. The answer is B. Any abnormal skin finding, especially non-blanchable redness, a sign of stage 1 pressure ulcer, and open areas, must be reported immediately to the nurse. Early intervention is crucial to prevent progression to severe wounds. Option A is incorrect because applying lotion and bandages without an assessment and order can worsen the condition. Some products are contraindicated on broken skin, and reassessing in several days is far too late. Option C is wrong because delaying reporting or documentation puts the patient at risk. Skin breakdown can worsen rapidly. Note: there is no option D provided for this question in the PDF. Question 4. You are assigned to care for Mr. Anthony Morrison, a 72-year-old male patient with advanced Alzheimer's disease who is hospitalized for treatment of a urinary tract infection and management of his dementia. During your morning care routine, Mr. Morrison becomes increasingly agitated and confused. He appears not to recognize you despite your introduction, becomes combative when you attempt to assist him with hygiene, and begins yelling and attempting to strike at you as you approach him with a washcloth. He is disoriented to time, place, and person, and his behavior escalates rapidly. He attempts to get out of bed without assistance, and you are concerned that he may fall or hurt himself or you. His wife is at the bedside looking very distressed and unsure how to help. Considering the complexity of this behavioral situation and your responsibility for safety, how should you respond to this patient's combative and aggressive behavior? Option A. Attempt to physically restrain the patient using bed rails and soft restraints to prevent him from getting out of bed and hurting himself. Explain firmly that his behavior is unacceptable and that he must calm down immediately. And continue with your care activities despite his objections. Option B. Remain calm and speak in a quiet, soothing tone. Avoid making sudden movements or touching him when he is escalated. Step back from the immediate situation. Inform his wife that you are going to get help. And notify the nurse immediately so that appropriate interventions can be implemented to de-escalate the behavior safely. Option C. Leave the room immediately without explanation and tell the patient's wife that you will return when he is in a better mood. Avoid any further interaction with the patient during your shift. And document in the chart that the patient was uncooperative and aggressive. Option D. Try to reason with the patient by explaining that he is in a hospital and that you are trying to help him. Attempt to convince him that his behavior is inappropriate. And increase your voice volume and use more forceful gestures to try to get him to understand your instructions. The answer is B. For a patient with dementia who is agitated and combative, the priority is de-escalation and safety. Option B is correct because remaining calm, not touching the patient, and seeking help from the nurse are the recommended steps. Option A is incorrect. Physical restraints should never be the first response. They require an order and can increase agitation and injury risk. Option C is wrong. Abandoning the patient and family is unprofessional and unsafe. The patient still needs care and monitoring. Option D is wrong. Trying to reason with a patient who has advanced Alzheimer's is ineffective and raising your voice will only escalate the behavior. The nurse needs to assess the situation and possibly implement pharmacological or environmental interventions. Question 5. You are working on a respiratory unit and are caring for Mrs. Margaret Sullivan, a 68-year-old female patient who was admitted yesterday with acute exacerbation of chronic obstructive pulmonary disease, COPD. She has a history of severe respiratory disease, currently requires supplemental oxygen, and has been experiencing significant shortness of breath. This morning during your rounds, you find her sitting upright in bed, leaning forward, using her accessory muscles to breathe, and reporting that she is having difficulty catching her breath. Her oxygen saturation has dropped to 88%, and she appears anxious and fearful. She is asking you repeatedly if she is going to be okay and whether she might stop breathing. In response to her respiratory distress and anxiety, which position and intervention represents the most appropriate clinical approach to support her breathing and comfort? Option A. Have her lie flat on her back in bed to allow her lungs to expand fully, and explain to her that this position will help her breathe more easily and that she should remain flat for the next several hours to recover. Option B. Place her in a semi-Fowler's or high Fowler's position with her head elevated at approximately 45 to 90 degrees. Support her with additional pillows behind her back and under her arms. Place the oxygen mask or nasal cannula as ordered, and remain present to provide reassurance while notifying the nurse about her respiratory status. Option C. Have her sit in a chair at the bedside rather than in bed. Suggest that she try to relax and calm herself, and assure her that her breathing will improve as her anxiety decreases. Option D. Encourage her to lie in a prone position facing toward the window so that she can focus on something external rather than her breathing difficulty, and dim the lights to help her relax and reduce her anxiety. The answer is B. The best position for a patient in respiratory distress is upright, semi, to high Fowler's because it allows maximum lung expansion, uses gravity to help diaphragm movement, and improves oxygenation. Option A is incorrect. Lying flat actually restricts lung expansion and can worsen shortness of breath, especially in COPD. Option C is wrong. While sitting in a chair might be upright, abruptly moving a distressed patient could be dangerous. Also, simply telling her to relax is not an intervention, and you should not leave her to get the nurse without staying with her. Option D is incorrect. Prone position is not indicated for COPD exacerbation. It restricts chest expansion and does not address the oxygen desaturation. The correct action is to position her upright, ensure oxygen delivery, stay with her for reassurance, and urgently notify the nurse. Question 6. You're attending a unit-wide in-service training about patient privacy and confidentiality in healthcare. The instructor is discussing the importance of protecting patient information and asks the group several questions about scenarios involving protected health information. In one scenario, you're asked what the primary focus of HIPAA, Health Insurance Portability and Accountability Act, is in the healthcare setting. After reviewing what you have learned about healthcare law and regulation, you need to select which statement most accurately describes the primary purpose and focus of HIPAA regulations in protecting patient rights and healthcare information. Option A. HIPAA regulations are designed primarily to protect and manage patients' financial information, such as insurance benefits, deductibles, and copay amounts, ensuring that this information is kept confidential from healthcare providers and that patients maintain control over billing decisions made by the hospital. Option B. HIPAA regulations are designed to protect patients' privacy and ensure that all protected health information, including medical history, diagnoses, treatment plans, and other confidential medical information, is kept secure and is not disclosed to unauthorized individuals without patient consent. Option C. HIPAA regulations are primarily focused on protecting the physical security of hospital buildings and preventing unauthorized individuals from entering healthcare facilities where patient care is being provided. Option D. HIPAA regulations were established to control and manage employee work schedules, vacation time, and employee privacy in healthcare settings, ensuring that healthcare facilities maintain appropriate staffing levels and that employee information is protected. The answer is B. HIPAA's main purpose is to protect the privacy and security of patients' health information. Option B correctly states that. Option A is incorrect because although HIPAA includes provisions about insurance portability, its primary focus in healthcare settings is on privacy of medical records, not just financial data. Option C is wrong. Physical security of buildings is not covered by HIPAA. Option D is wrong. Employee work schedules and privacy are not the focus of HIPAA. It is about patient information, not staff. Great job. Don't forget to subscribe. Bye.